Today, I am going to talk in brief about an entity called as non-alcoholic fatty liver disease. This is very commonly referred to as fatty liver. It is not uncommon for you or your family members to have heard about this entity called as fatty liver. It is often seen that this entity is regarded as a very dismal and as a very innocuous or innocent entity, which is not actually the case. So what basically happens in fatty liver is that fat droplets go and accumulate in your liver. In some patients, in approximately 25 to 30% of patients, the fat in the liver can actually trigger a swelling in the liver, which in the long run can cause what is called as non-alcoholic steatohepatitis, which means that the fat is triggering swelling in the liver. If the swelling is persistent for a long period of time, it can cause scarring of the liver, which we call as NASH-related cirrhosis of the liver. This also can lead on to the development of liver cancer. That is the reason it is very important for us to find out whether a patient of fatty liver is actually in the innocent part of the spectrum, wherein the fat is not damaging the liver, or wherein the fat is actually triggering a swelling in the liver and affecting the person's liver. Once we diagnose that, there are a lot of treatments available for fatty liver. The most important point which we need to understand that this entity is actually seen in people who are having obesity, people having a sedentary lifestyle, people who are having a very bad control on their diabetes, people who are not having a good control on their hypertension, people whose bad cholesterol is really up and the good cholesterol is actually down. So this spectrum is actually called as metabolic syndrome. So the treatment of fatty liver actually targets all these components of metabolic syndrome. The most important thing which you can do is break away from the sedentary lifestyle. Daily brisk walking of 35 to 40 minutes daily of brisk walk is very important, and along with it taking a calorie deficit diet. It is often seen that people who are diagnosed with fatty liver will only restrict fat items, which is not true. You need to reduce the entire spectrum of calorie based items, like reducing your sugar intake, reducing the fat intake, reducing the intake of fructose based items, all the cool drinks. These things have to come down. You have to maintain a good protein intake, and you need to get going into a good brisk walk of approximately 35 to 40 minutes every day. After this, your treating hepatologist is going to see whether the fat is sitting innocently or whether it is triggering a swelling. And if it is triggering a swelling, we have a lot of drugs which we can give to our patient in order to reduce the swelling of the liver and make sure that this entity does not scar your liver and does not lead on to the development of cirrhosis. So with this, we understand that fatty liver should not be taken innocently. Fatty liver can become significant in some proportion of patients, and we need to treat it aggressively. Thank you.